Why is she so beautiful? Let me have the caliper here for a second. I'm going to show you why this lady is so beautiful, okay? We take the distance between the eyes. This is the way that I do it, called the intercanthal technique. People call it the Swift technique, whatever you want to call it. And you measure the distance between the eyes like this, okay? This gives you 1 over here, 1.618 over here. The original calipers that I got off the net going back in 2003 when I was thinking about this were for the automotive industry. And they looked like a pentagon. They had 5 fingers coming out of it. They were very similar to the ones that Da Vinci used. And I was so excited to try to measure patients that I had it in my drawer in my office, and the first patient walked in on Monday morning, didn't even have a chance to say hello to me, or introduce myself, and I said, "Can I measure your face?" They said, "What are you talking about?" I said, I have this idea. Da Vinci talked about beautiful proportions, and I think you have some beautiful proportions on your face. Do you mind if I measure you? The patient said, "Sure, no problem." Never been refused. It's amazing. So I came at the patient with this thing that looked like Edward Scissorhands, and they recoiled, and I said, "Okay, we got to come up with an idea that's a little bit sexier. But if you go ahead and you take a look over here, and you do the intercanthal distance like this, then I can tell you that her eyebrow is going to be 1.618. Because she has beautiful brows. I could tell you that the peak is going to be at 1. I could tell you that her forehead height is going to be 1.618. Look how ridiculous this is. I can tell you the distance between her eyebrows is the distance between her eyes, is the base of her nose, is the volume of her lower lip, is the width of her chin. There's a reason for why people look the way they do. This is the proportion talking to you. And if we measure over here, and she's going to say to me, "Oh, you're telling me I'm perfect, I don't need any injections," right? She's getting upset. Look. Now when I measure for the width of her face, I have a little gap over here. See that? I use this as a plumb line. Facial width should be about 1.618. So what is it telling me? It's telling me, "Hey doc, you can add a little bit of volume in there and you can get her cheek raised and also create the light reflex. Look at the difference of what her face looks like right now when I just do that." Patients do this. Why don't you do it internally for them? Okay? So, if I take a look at the length of her nose, if you take a look at the length of a nose on a female, the length of a nose is from the lash line to the tip. She's pretty close. If you take a look at the projection of the nose, all this is in your book, so you can play with patients and do whatever you like if you're trying to show them for a reason for why you're doing what you do. This is projection over here. So you can tell them, and when I use it sometimes is when I have the young patients that are coming and saying, "I want more volume in my cheeks." I said, "I can't do it. But I want more volume. I think I need more volume." I said, "You know what? I think you don't, but let's ask Da Vinci." Can't argue with him. He was the smartest guy. And they say, "Okay." And then I show them that the volume is appropriate, and they back off. They say, "Wow, I didn't realize that I was perfectly proportioned." I said, "Yes, you are." Okay? I'm going to go with 1 up, 1 over. Start off with that. I'm going to feel for the temporal crest right here. I'm going to draw it out for you so you can see it. There we go. I go 1 centimeter up from the orbital rim, 1 centimeter over. That puts me here. Not up here, 1 centimeter from the brow, but it puts me here. I put my finger over there. I don't feel a pulse, but we're going to take a look. You're looking at me. You're the one that always tells me what I have to use. Let me use over here, judging by her skin, the fact that I want to get enough oomph to it that it'll lift, the fact that she has a saucer-shaped temple rather than a really deep temple. Contour. You knew it, huh? Of course you knew it. All right. So I'm going to use contour over here. Is my injection going to be at an angle or is it going to be vertical? And what depth am I going in on that? How deep? Deep is a relative word. To bone, okay? What else am I going to do? Guys, you're guiding me, so I better do this right. If it doesn't work out, it's their fault. I'm going to aspirate. Hanging down by my side over here. Ah, the hairline stuff. You ready? Here we go. We're going to clean it up, keep my pad ready, balance my hand like this. Here's the area that I want to inject. Patients of color, you really can't see what you're going through. I have an idea there might be a little vein over there, a little flick, and I'm down on bone. I aspirate. I hold it for 2 seconds. That's what the study showed. You'll either get a flashback in most cases within 2 seconds. Balance my hand, finger over here, slow injection. Where am I looking? I'm looking at the skin, and then I glance over at the glabella. So let me tell you, I always say that you look at the road and not the steering wheel. How you doing? You're good. You look at the road and not the steering wheel when you're driving, so I'm looking at the skin, not the syringe, but I have a rear view mirror, and that's the glabellar region right here. There are choke vessels in the glabella that have been shown to be very sensitive, extremely sensitive to hyaluronic acid. HA is inflammatory to those, and the second that they get a little bit of HA, they go and start to contract. And when they do that, they get blanching. So this is your rearview mirror. I'm watching here as I inject. I glance over there to make sure there's no blanching, and then I look back at where I'm injecting. So you're driving the car. Okay, I'll put in, let's say, 0.4 or 0.5, pull the needle out. And why am I putting pressure right away? Remember I showed you that sentinel vein? That's the vein that's deep. You won't see bleeding at the skin. There isn't. But she might be bleeding underneath through that vein. I used a 30 gauge needle with the product. I love to use thinner needles, and Ravenesse products flow. So I want to make sure that if I punctured that vein, that she doesn't come back in 2 days with a greenish, yellowish bruise over there. So I hold that over here. How you doing? Wasn't too painful? Not at all. If you do that, you have to warn the patient that during the day they might feel as if they were chewing a tough steak. Because where did my product go? It came up, it hit its head on the deep temporal fascia, it spread along the muscle. You'll find it inside the muscle and along. I told you products usually don't like to be so much inside the muscle. That's why I use a very nice kid on the block. And we hold a little pressure. And we turn her head back this way. And we take a look. And we see, have we kicked the tail of that brow up? And the answer is yes, okay? What you want for the tail of the brow over here is it to be higher than the medial brow. If you look at, even though she has a much more exaggerated arch over here, okay, on this lid, what you'll notice is that the tail of the brow is down below the arch, below the medial part. Here we want the tail of the brow up, like that. It's a much more pleasing, sexier look if you want it. I didn't know when to start injecting temples, to be honest with you. So I called my friend Stephen Liu from Australia. And I said, Stephen, when do you do temples? I said, I have these patients that are coming in that genetically they have very hollow temples. Do I have to fill them? Stephen's amazing because he likes to cock his head to the side. He thinks about it and he goes, Offa? He's Malaysian. Okay, he goes, Offa? He says, if they look in the mirror and they can't see the tail of their brow because it disappears around the corner, inject them. What a brilliant statement. It's a beautiful feature, and if they don't see it on the AP view, then you should inject those temples to get the tail of the brow to show, like that. Okay? Good. Look up into the camera. Yeah, you are. Okay. Look up into the camera. We're going to take a look. Excellent. Perfect. So that's the one-up, one-over technique. Are there any questions about that? By putting your finger over here, you're forcing the product to come down over here. We're going to take a look at the temple that's flatter on the other side. And what you're trying to do is you're trying to obliterate this ridge here, which is the temporal crest, because we don't like to see bony landmarks on women. We like to see smooth transitions and contours. On the other side, what I'll do is maybe I'll use, because her eyebrow is already elevated on that side, she was a little bit spocking on that side, I'll do the subdermal technique, because you're not going to get as much an effect on the eyebrow. I'll get a little bit of tail elevation, which is what I want, but I'll be able to contour. Maybe I'll do that right now, okay? If I'm going to go ahead and do temple contouring, it's so easy to do this, to come from below. But that's the way the vessel is running. So the idea is to either come from lateral, this way, or this way. So you saw me do it on the video from here. So you know what I'm going to do? I'm going to do it from the other side, just to show you that you can do it from whichever way you want. Okay? So we're going to go ahead and we're going to do it from the eyebrow. So you can contour over here. The zone that I'm actually targeting over here is the subdermal layer. That means that the cutis retinacula, which are those little fibers that come up through the fat that attach to the dermis, I have to feel them popping. So you're going to feel a little bit of tick, 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 but you shouldn't feel any pain, okay? Great. So we're going to clean this up. Catherine's going to give me probably a 30 gauge needle for a 25 gauge cannula because she likes for me to struggle on stage when I can't seem to get it in. She's done that before. I say, how come I can't find the hole on this thing? Right? Don't tell them. I'm giving away your secrets. 25 gauge needle, 25 gauge cannula. I know that they pack larger needles, but I told you the needle, the track of the needle, it's so 20. Oh, you gave me a 23, even you haven't got a 25. The needles make a bigger tract anyways. Okay, and I like to use the smallest needles, but this one she gave me was a 23, so we're going to try to make sure that we don't hurt you over here. I'm going to give you a little flick, and it's in, okay? I pinch the skin up into the needle, and I leave the needle in for a couple of seconds. If you're inside a little vein, you're going to get a flashback, and you'll be ready with your gauze pad. Don't jab and remove. Now you'll notice that when I take the cannula, that's a long one. That's all you have. We're really okay, fair enough. If you take a look at the cannula, it's really putting me to the test here, okay. If you take a look at the cannula, I'm holding it like a pencil. I see, like yesterday we were doing it, and I see a lot of people try to put the cannula in like they're going to inject, which is like this. Do you write like that? I don't. Or I see them trying to do it like this. I don't write like that either. Maybe I paint a bit like that. But when I write and I want to have precise, and now it's going to be a real challenge because of the length of the cannula, I want to be able to go ahead and to have perfect control over the tip. So Catherine's going to remove it, probably, or maybe she might leave it. I'm going to find my little hole right here. We're going to poke in, and the second that I get in, I'm flattening out my cannula. Do you see, for a little drop of red stuff, I want chlorhexidine on the sponge. We have a rule in liposuction. Never touch the part of the cannula that's going into the patient, because you might have contaminated yourself along the way. You should have that same rule. Never touch the part of the cannula that's going into the patient, but I don't want the blood to drip down her face. So if I'm going to touch it with somebody, it's got to have chlorhexidine on it. Keep on wanting to change it, huh? Okay. I can now go into my injection mode, keeping it flat, and I inject very slowly. Look at the resistance that I'm having. That resistance tells me I'm in the right place. A little inflation, and I get through it. You see how superficial my cannula is? I lift it, you can see the contour of the cannula. So I know that I'm in the subdermal plane, and I'm not inside the superficial temporal fascia, which has the artery. How you doing, Gleed? You're doing great. And so I can coat it just like this. Nice and gentle, back and forth. I feel like I'm standing in the other room with this long cannula. Okay. I'm like a foot away from you here. Okay. And and you'll notice again that I have the plunger. Can we pan out a little bit, Brendan? Let's zoom out just a bit, Brendan. Thank you so much. You'll notice where the cannula is. It's at the base of my thumb. I'm not injecting like this. I'll give you a little challenge as I'm doing this. And the challenge is to take a 10 cc syringe, okay, and to load it with water, and to take an 18 gauge needle, and I want you to try to hang a drop of water off the tip of the needle. Try to do it with your thumb. You won't be able to. Put the plunger into your palm, or at the base of your thumb, and then just in your head think squeeze. And not only will you be able to get that drop of water to hang off the 18 gauge needle, but it's going to get bigger and bigger and bigger and bigger. So anytime you want to control product flow when it's really minute, which is here if I'm coating under the dermis, which is around the eyes if I'm doing a tear trough or infraorbital hollow, I never hold the syringe like this. I'm always doing this, and it feels weird. It does feel weird, but you got to get used to that. Any questions about the subdermal? So for a product like this, I want to use the thin product. I use the same one that I had up over here. Contour was this, Kiss was this, okay? So I'm using a product like Kiss. I would use a product like Revise. I could use a product like Ultra. The product that you're using is dependent on the thickness of the skin. I don't want the skin to show any bumps or lumps. You can see that with the injection, it's nice and smooth. Okay, we don't see that rim or that ridge over here anymore because it's been blended in very nicely. Okay? Perfect. We're going to try all types of things on you. Yeah?
Do you ever use both techniques to fill the whole line?
If you have a very deep temple, again, like every area of the face, if you have a very deep temple, don't try to do everything at one level. So what I usually do is if I have a temple that's saucer-shaped like this, I know that, and it's deep, I know that the one up, one over is not going to be able to fill the whole thing. I'll need too much product and it's going to end up in her cheek. So I stop my one up, one over anywhere around 0.5 to 0.7. That's it. Then I look and see what's left. If she has a little bit of hollowing down here, I just go in with the cannula and fix it. If I've used 0.7 and I think I can put another 0.1 or 2 to get it, I don't go in with the needle here. Never do that. Because that's where the middle temporal vein is. I showed it to you when we were doing the anatomy dissection. If you lift up the deep temporal fascia, it's sitting in the deep temporal fascia. And that middle temporal vein has been hit several times, and people have had pulmonary emboli as a result, and 2 people died from that. So you don't want to go in with the needle over here, you want to go in with the cannula. Or you can go back to your original place, the one up, one over, that's the safer zone, not the safest, but the safer. Put 0.2 more, and then push it with your thumb. So I use 2 techniques for that. In her case, I'd like to get a little tightening over here, and even if I wanted just a little bit of tightening, maybe I'll show you the bolus technique. Would you like to see that? They say yes. So I'm going to use a shape, pure, on a 22 gauge. Okay, so we're going to do the bolus technique over here. This is the third, and I'll show you 3 injection techniques for the temple. The bolus technique isn't really to do much on the temple aspect of it, it's to tighten this area right over here. Okay? She's not that lax, but she's being nice about allowing us to show it over here. We'll take up with everything, and then when you come back again in 2 years, 3 years, you'll still look the same like you look when I last inject you. Where am I going? Anterior to the tragus, 1 centimeter. So I want to be somewhere about over here. Put my finger there, no pulse. But if I go up over here, big pulse, really big pulse. So I want to be superficial when the artery is deep here, and then I want to continue my superficial because the artery is in layer 3, and I'm going into layer 2, just above it. Okay? So, here we go. What have you got for me, Kat?
Exactly what you
A
want.
22 gauge needle?
For a 22 gauge.
For a 22 gauge cannula. Okay, fair enough. All right, Galit, you're going to feel a small little stick. Again, I pinch the skin up into the needle, and I'm putting it in just subdermal like that. Leaving it to make sure that I don't see any flashback of blood. Spin it. Windshield wiper it. Whatever you like. But to jab and remove, everything's going to collapse. Okay? All right, I can't even get my fingers close to this. Go ahead, Kat. Let's try it. Okay, now that I got bleeding, I can find it. Perfect. Again, a little pressure here, okay? Am I going to go superficial or deep? Superficial. If I can get it in through the dermis, this long cannula, there we go. And now I'm pushing my cannula down. Galit, what you're going to feel is you're going to feel little pops. There you go. One little pop, two little pops. Do you see the way the cannula is popping? Three little pops. It's like three little piggies in a row. Okay? Another little pop over here. And I want the tip of my cannula to be somewhere about over here, above the helix. Okay? Good. There we go. I lift my cannula up to see how superficial it is, which it is, and the tip of the cannula is right about over here where I want it. I'm going to actually aspirate because it's a 22 gauge cannula and I'm sitting right over the artery. I'm going to keep my hands out of the way for you. What am I doing with this finger? Blocking the proximal portion. And here we go. We're slowly starting to inject. You're going to feel some pressure but no pain. Okay? And as I slowly start to inject, and this is going to be an interesting injection because of the long cannula, there's a lot of resistance, but I'm going slow. I'm watching the skin of the forehead. I'm watching the skin of the temple. I'm watching to see how comfortable she is. And I'm injecting very slowly. And what I'll do in her case, and I can feel my finger pulsating from the artery that's underneath it. And what I'm trying to do is I'm trying to create a devil's horn over here. So it's a nice slow injection. I can't inject any faster anyways because of the length of the cannula. The longer the needle, the longer the cannula, the more the resistance. That's Poiseuille's law too. And I'm going to put in, like I said, the maximum I'm going to put in is about 0.5 to 0.7. I'm going to stop about over here. I'm going to pull it out. Look how much I'm pulling out. It's like I was up somewhere over here. And then we're going to dry it up. And if you were to feel over here, I don't know if you can see it. You can, I think, huh? You see that bulge? So you're going to have a little bulge when you comb your hair that's going to stay there for about 2 or 3 weeks. I'll be in Mexico. Don't worry about it. Just kidding. So it's going to flatten out with time, but what it's doing right now is it's helping to support this part of the face, okay? I'm going to combine that with another injection over here because we talked about tightening up your jawline. I'll do that. Any questions about that technique? You must feel the pops. Use the cannula length that's not as long as this. This was about 2.5 inches, maybe 2 inches or 1.5, okay? It's a lot easier to control. So we did one up, one over. We did superficial. We did Codafana horn over here. Let's see if it's had an effect. I think it has. What do you think? She's looking that she's already getting tighter over here. I haven't even touched this part of the face, and look how she's... It's crazy what you do sometimes because we're starting to see the corner of the mouth come up too. Okay? And I haven't gotten anywhere to the mid-face, which we're going to do now. Because remember, we go higher before lower, lateral before medial. So we're following all the proper syntax of where we're supposed to do it.